The problem with the NHS is that it seems to duck responsibility and it doesn't communicate properly. And although there have been some private members' bills to try and help the NHS learn from its successes and from its failures, like, for example, Chris Heaton Harris's bill about hospitals keeping a record of good practice. That's about 10 years ago. The NHS still, one hospital doesn't talk properly to another. GP notes are not immediately available, and this is a major failing. We can talk about the case of Valdo Calocane and mental health, but that is an aspect of the NHS failure. And the murder of 3 people in Nottingham in July 2023, appalling. It highlights the profound failures in the UK's mental health care system and in the NHS itself. Despite a history of violent psychosis, repeated hospital admissions, documented concerns from his family, the NHS failed to ensure that Calocane remained on his prescribed medication. The failures of the system, compounded by an overburdened mental health service, by extremely overstretched mental health practitioners, a flawed risk assessment process, a culture of passive discharge contribute directly to the deaths of Barnaby Webber, Grace O'Malley Kumar and Ian Coates, and it could have been avoided. The independent report into Calocane's care, commissioned by NHS England, reveals a catalogue of errors and oversights, and among the most glaring failures were failure to enforce treatment, despite clear medical recommendations for antipsychotic medication, a long-acting injection that could have ensured compliance. Calocane was not required to take it because he didn't like needles. That is absurd. The passive discharge policies, repeatedly Calocane disengaged with services, missing appointments and refusing medication, and rather than escalating interventions, healthcare providers allowed him to drift away from the system, ultimately discharging him to his GP in September 2022 with no further follow-ups. This is absurd. The inadequate risk assessment. Although medical notes warned that Calocane had no insight or remorse and was a clear danger to the public, risk assessments were inconsistent and crucial details were omitted or downplayed. Again, absurd. This is supposed to be our National Health Service. Its primary duty is to the public, to protect the public. And we can talk about the overstretched health services. We can talk about, as the report does, the report highlights dangerously high caseloads for care coordinators, with some managing more than 20 patients, well above the recommended limit. And the pressure to clear cases have led to premature discharges without adequate safeguards, and this is one example. And a recurring theme in the report is the fragmented nature of Calocane's care. Each hospital admission was treated in isolation with no cumulative perspective on his escalating risk, and key information was not shared effectively between different teams, and even within the NHS, clinicians lacked access to complete patient records. This is not only absurd, this, I think, is a form of negligence which may indeed even be criminal, and this runs through the NHS. We pay so much money to NHS CEOs of trusts, to these middle managers, and to the people, the little boffins in NHS England, who have overseen and drawn up this report. Why are we paying so much money to them when we could be paying that money to people who could fix the computer system? So at one touch of a button, a GP can see the hospital treatment of a patient. A hospital can see the GP history of a patient, the notes. Instead, we are in some sort of arcane nonsense, a sort of purgatory, where we are waiting for information, where we are dependent on information that simply isn't accessible. The lack of coordination in this particular case extended beyond the health services. Police officers who acted with, who interacted with Calocane noted his erratic behaviour but were unable to intervene effectively because of unclear protocols and limitations in mental health law. His family repeatedly voiced concerns, warning that he was dangerous, yet their pleas went largely ignored. Why? The consequences of these failings are devastating. In June 2023, after months without mental health intervention, Calocane launched a violent attack, fatally stabbing Webber, O'Malley Kumar and Coates before using Coates' van to mow down 3 more pedestrians, seriously injuring them. None of that needed to happen. The response from NHS officials and government representatives have been one of regret and promises of reform. But years have gone by. Years have gone by since, for example, Chris Heaton-Harris noticed that there were serious problems with record keeping. Private Members Bill, back 10 years ago. 2016, I think. This is madness. This is madness when we are paying top brass to trust managers who are the subject of serious reports about not paying their employees, and then turn up with a friendly interviewer on the BBC to talk about their Christmas jaunt into the hospital to check that all is well. There is madness here. We should not be paying so much money to these bureaucrats when it's bureaucracy which is the major problem with the NHS. Why are we paying so much money to these people who are just twirling papers around on a desk and not communicating with one another? We need a proper computing system that can be accessed by any member of the medical staff at the touch of a button from anywhere in the United Kingdom. And, there are key questions about the NHS's approach to mental health care as well. Should community treatment orders be more widely enforced? The reluctance to impose stricter medication requirements on high-risk patients, even when their history indicates a likelihood of non-compliance, must be reconsidered. Is the current least restrictive approach fit for purpose? The NHS's emphasis on minimal intervention failed catastrophically in this instance, and a balance must be struck between a patient's rights and public safety. And, how can risk assessment be improved? By communication. The system must move beyond treating each incident in isolation, and instead it must take a holistic, long-term view of a patient's behaviour because it has the notes in front of it. This involves structural reforms. Mental health services are underfunded, understaffed, yes. And without investment in more personnel, better coordination, tragedies like this will continue to occur. But underlying all this, without investment in proper integrated computing systems, the NHS is going to crumble into nothing, into goodwill by the people that we actually see. And meanwhile, the people we don't see in NHS England, in that huge building in the middle of London, will be raking it in. That building needs to be stripped. The case of Valdo Calocane is a stark reminder that the UK's mental health system in the NHS is in crisis. And while the NHS cannot bear sole responsibility, government policies, funding decisions, social attitudes towards mental illness all play a role. The findings of the independent report leave no doubt that significant change is required and better computing integration is absolutely vital and is well overdue. If meaningful reforms are not executed and enacted, the failure to manage care in the community will claim more lives. And the NHS will continue to be a system designed not for success, but for inevitable failure.